Hello everyone, welcome to Prakash Med. Today we are going to learn one important topic from first year Mbbs, that is brachial flexes. Uh, okay, let's start our class. Brachial flexes. First, we need to know what is the meaning of brachial flexes. Brachial flexes means a group of nerve fibers that forms a network. They are going to supply the skin and muscles of all over the upper limb. Okay, these brachial flexes, first we need to know where they are arise from. Firstly, they are arise from the anterior primary ramus of ventral division of last C5, C6, C7, C8 and the first T1 spinal nerves. The components of brachial flexus are for our understanding we are dividing into roots, trunks, divisions and cords, finally branches. Let us learn in a detailed way of these brachial flexes. Firstly, roots. Roots are spinal nerves. They arise from intervertebral foramina. They are C5, C6, C7, C8, T1 spinal nerves. These roots are present in the root of neck. Roots sometimes C4 and T2 are also contributed to this formation. When C4 is more, then T2 contribution, it is called as prefixed brachial plexus. When T2 is more contributed than C4, it is called as postfixed brachial plexus. Roots are 5. As we all know, C5, C6, C7, C8, T1. And we are going to learn how the trunks are formed. By the C5, C6, they form upper trunk, and C7 alone forms middle trunk. C8 and T1 forms lower trunk. This is about trunks. Trunks are 3. Okay, let's know about how these trunks are going to divide. Each trunk, they are dividing into anterior, posterior divisions. And let's learn about how the chords are formed. Anterior division of upper and middle trunks forms lateral chord, and all the posterior divisions of upper, middle and lower trunks forms posterior chord. And anterior division of lower trunk alone forms the medial chord. We came to know that chords, how they are formed. That let's summarize about chords. Lateral chord formed by anterior division of upper and middle trunk, and what middle chord is formed by anterior division of lower trunk, and posterior chord is formed by all the posterior divisions of all 3 trunks. They are lateral chord going to give branches. One main branch of lateral chord is musculocutaneous nerve. This is the main branch of lateral chord. Then posterior chord gives axillary and radial nerves. These are the main branches of posterior cord. Then middle cord gives ulnar nerve. This is the main branch of medial cord. Let's see about by drawing how the brachial flexus form. C5, C6, C7, C8, T1. These are roots. C5, C6 forms upper trunk. C7 alone form middle trunk. C8, T1 forms lower trunk. And these trunks going to divide anterior and posterior division like this. These division going to form this is lateral cord. All the posterior divisions of all these trunks going to give posterior cord, and one anterior division of lower trunk gives medial trunk, medial cord. Let's see about branches. In the roots, C5, C6 upper roots gives dorsal scapular nerve, and C5, C6, C7 gives long thoracic nerve, and one main branch of lateral cord is musculocutaneous nerve, main branch of posterior cord axillary nerve, and radial nerve. Lastly, this medial cord gives to ulnar nerve. Some minor branches are given from the cords from the upper trunk, like nerve 2, suprascapular, nerve 2, subclavius, and lateral cord going to give branches for upper subscapular, lower subscapular, and now to latissimus dorsi. Some branches of medial cord is medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and minor branches of lateral cord is lateral pectoral nerve and medial root of median nerve from medial cord, lateral root of medial nerve from lateral cord. This is all about brachial flexus, how they are formed. And we have lesions of brachial flexus that is involving upper roots and lower roots. If upper roots like C5, C6 are involved, they are called as Mbbs paralysis. If C8, T1, these are lower roots are involved, these called as clumpis paralysis. In clumpis paralysis, all intrinsic muscles are damaged of upper limb. In this Mbbs paralysis, muscles like deltoid, infraspinatus, supraspinatus, and some more muscles in front of the hand, in front of the arm and hand. In clumpis paralysis, Horner syndrome is present. How these are going to happen in our day-to-day life? In Mbbs paralysis, during delivery, traction of head that leads to lesion of upper brachial plexus, and whenever a person fall from the certain height, that leads to increase the angle between shoulder and head in Mbbs paralysis. And if we see with clumps paralysis, there is increase in the angle between trunk and shoulder. This is also involved in like during delivery, whenever the doctor pluck the baby with the hand, that leads to clumpus paralysis that involve in the lower brachial plexus paralysis. There is increased angle between shoulder and head. This involves upper brachial plexus paralysis. During delivery, traction of head. This leads to upper brachial plexus paralysis. Upper brachial plexus paralysis, it is also called commonly as policeman tip, waiter's tip. See how the hand is shown. These all about upper brachial paralysis. These are lower brachial paralysis. There is increase in the angle between trunk and shoulder in a overstretched hand. While during delivery, plucking the hand of baby, that leads to lower brachial plexus paralysis. See, these are the upper brachial plexus paralysis. It is also called as Mbbs point, which are involving the 6 nerves like C5, C6 roots, and they are going to give upper trunk. Upper trunk gives nerve to subscapular, nerve to subclavius, and the upper trunk going to divides anterior division and posterior division. These all 6 nerves involves in the Mbbs point. Okay, this is all about brachial plexus. Study well and all the best for your exam.